In today's Health in Focus, let's talk about a term you are starting to hear more about: social distancing. According to the CDC, social distancing is remaining out of congregate settings, avoiding mass gatherings, and maintaining distance approximately 6 feet from others when possible. Experts are stressing this approach should not be taken lightly, and working remotely or from home certainly should not be treated as a vacation. From schools to museums to amusement parks, closures and daily disruptions from the coronavirus have become the new norm.
I do think it is the right thing to do right now, and we are facing a crisis, and I think this will help, and we will focus on treating those who have the most severe forms of the illness, and we will all get through this together.
Dr. Lisa Maragakis, epidemiologist at Johns Hopkins Medicine in Baltimore, says even if you don't have symptoms, staying away from crowds and keeping your distance from others should be the mindset for now. Social distancing, a new buzzword.
It's anything from not shaking hands, not hugging and kissing someone, to really just leaving more space between yourself and someone else.
Dr. Maragakis cautions any symptoms, even mild ones, should be taken seriously, meaning parents and individuals need to stay on alert and stay home when sick.
It's not a vacation. There's a very serious reason for the school cancellations. This is not a time for any of us to get together in large gatherings outside of work or outside of school.
Health experts say the goal here is not only to keep yourself safe, but to protect the more vulnerable in your community who are at risk for severe disease.